In most cases, the best way to replace missing teeth is with dental implants. Dental implants are small titanium fixtures which are inserted into the jawbone during a routine surgical procedure. The jawbone then heals around the implant and integrates it, a process called osseointegration, making the implant a very strong anchor to hold teeth. If you're missing a single tooth, there are two options to replace the tooth with a fixed restoration. One option is a 3-unit bridge, which has been used in dentistry before dental implants became available. While a 3-unit bridge can still be the option of choice for some situations, it is associated with several disadvantages over dental implants. A 3-unit bridge requires grinding down both adjacent teeth, called abutment teeth, to stumps, hence causing irreversible loss of healthy tooth structure. A 1-tooth problem becomes a 3-tooth problem, since the adjacent teeth will now also require treatment. If the bridge fails in the future, it often means that 3 teeth need to be repaired or replaced. Food tends to get caught more often under a bridge, and cleaning is more challenging since one has to floss underneath the pontic. This chronic food impaction often leads to dental decay or periodontal disease and bone loss at the abutment teeth over time, which, when not detected early, can lead to the loss of one or both abutment teeth. The 2 abutment teeth have to bear the load of 3 teeth now, which puts the abutment teeth at a higher risk to break. If one of the abutment teeth had a root canal in the past, this risk is increased substantially since root canal treated teeth are weakened and brittle. Aesthetically, it is often more difficult to make teeth look natural when the individual teeth are splinted together instead of being separated. When replacing a missing tooth with a dental implant instead of a bridge, many of those inherent disadvantages do not apply. Healthy tooth structure at adjacent teeth does not have to be sacrificed. A 1-tooth problem remains a 1-tooth problem. One can floss easily. A dental implant cannot experience dental decay since it is made out of titanium. Adjacent teeth do not have to bear additional load, and the result in most cases will be aesthetically more pleasing. The placement of dental implants is a routine surgical procedure for experienced and well-trained clinicians. It entails 2 parts, a surgical and a restorative part. The surgical part, placing the fixture, will be done in my office, while the restorative part, placing the actual tooth on top of the fixture, will be done by your primary care dentist. Therefore, please note that the treatment estimate you will receive today only includes my part of the treatment, but not the restorative part, which will be done by your primary care dentist. After local anesthesia, also known as Novocaine, is administered, the gum tissue is reflected to give access to the jawbone. The dental implant, a small titanium screw, is then inserted into the jawbone. If there is not enough bone to allow for placement of the implant, a bone graft may be needed to regenerate the missing bone. The bone graft I will use is either a bovine xenograft, meaning bone from the cow, or a human allograft, meaning human donor tissue. Both bone grafts are safe to use and have been tested extensively over many years. A porcine collagen membrane using collagen from the pig is then placed to cover and protect the bone graft. Sometimes Growth factors are used to improve healing and boost bone regeneration. After the implant, and if needed the bone graft, have been inserted, the gum tissue is sutured around or over the implant, and a healing period of 2 to 3 months is allowed for the implant to integrate. A small uncovering procedure may be necessary if the implant needed to heal underneath the gum tissue. If the gum tissue around the implant is too thin, a gum graft may be needed before or after implant placement. After the implant has healed successfully, your primary care dentist will continue with restoring the implant and putting the actual tooth on it. After the failing back tooth is removed, the jawbone needs to heal for 3 months before it can receive the implant. After the implant is placed, it needs to integrate for another 2 to 3 months before it can be restored. Therefore, for a standard back tooth implant, it will take 5 to 6 months from the time of extraction until I can send you back to your primary care dentist to restore the implant. Dental implant treatment has become one of the most predictable procedures in dentistry when performed by a well-trained and experienced clinician. Possible complications include excessive bleeding, infection, nerve injury, and implant failure. With proper planning and execution, and when post-operative instructions are followed, these complications are rare. Should an implant fail to integrate, which may occur after an infection, the procedure may have to be repeated. Permanent numbness as a consequence of nerve injury is possible but extremely rare. Bruising and swelling are common and usually last for a week. You will have to eat soft food for at least 6 weeks after the procedure and will be asked to minimize physical exercise for the first 2 weeks. Postoperative antibiotics will be given to prevent an infection. The procedure itself will not hurt since you will be numb. There will be mild to moderate discomfort for a few days after the procedure, which usually can be managed with over-the-counter pain medication. So, congratulations for taking the first step to dental implant treatment and a better quality of life by visiting our office today. We're looking forward to treating you.